Welcome to Your Health Matters. Welcome to Your Health Matter OC tonight. This is a very special episode. This is Dr. Clayton Chow and Dr. CK. We are here at the headquarters of county government in downtown Santa Ana. Actually, very beautiful, brand new buildings. They just moved in about a couple weeks ago, right?
2 weeks ago.
Tonight, there's a special event that's going on. Is going to be lightening up lights all over Orange County, particularly here on this site, to light up hope for people who are living with chronic suicidal thought or a family member who have lost a loved one to suicide. So this is a very important event. I can tell you that we have gotten so many collaborations and partnerships throughout Orange County, to name a few places that will be lighting up their light together with us here tonight. Knott's Berry Farm, Henderson Beach Pier, Dana Point Harbor, the city of Irvine City Hall, and a couple other places.
John Wayne
Airport and the Nixon Library, to name a few. So if you live close by those places, please go out and see the light. They all get light on at the same time. But before we go and interview, I don't know if you could see, we have a lot of our participant organization here tonight to really participate in this event, giving out resources on mental health and mental health prevention. So, but before we go and talk to them, they are nervously waiting for us to come and talk to them. You want to give us the update on COVID?
Yep, so far, so good news, we're still stable with our numbers.
Okay.
We have 150 who are hospitalized with COVID and 21 who are in the ICU with COVID. And we're hearing from our community business organizations that people are coming out to get their vaccines. I know Cal Optima had a very successful vaccine clinic over the weekend, and we're hearing that a lot of the pharmacies are also delivering a lot of vaccines. I got my vaccine last Friday, and it was great.
I got it the first day that it was available at CVS. 10 o'clock that Friday night, I got mine. So.
And I have to admit, this is the first time I didn't really have much reaction with the vaccine compared to the other doses, so I feel more comfortable. Good news is we're outdoors, we have great ventilation, and our community now is in the low community level. But I still urge everybody to continue to wear your mask, especially when you're indoors, or if you're higher risk. Please still pay attention to those recommendations because they will save you. They can protect you from COVID and a lot of other viruses that are circulating around our community.
And I also want to remind people that when you get your updated booster shot for COVID, please consider getting the seasonal flu vaccine.
Yes.
Really, this year we're expecting that to come back because people are now without masks. Right.
We're already
people
hearing.
Are moving freely, so we already see people with the regular flu. So you can get both the COVID booster and the flu vaccine at the same time. And in fact, that is probably the best way to do it. Save your trip, and if you have reaction to vaccine, it save you one time of getting different vaccine at different time and different reaction.
Right.
There was some rescind of order from the California Department of Public Health last week. Right? I know there was some confusion, but one thing for sure, if you work in a healthcare setting, congregate setting like a shelter, or city jail, what have you, you are still required to wear a mask, right? So that has not changed.
Right.
So that is the one thing that is constant. So if you work in those setting, or if you go into those settings, please expect the employees as well as yourself, when you're in those settings, that you still have to wear a mask.
Right.
Okay.
And also the staff members in those high-risk settings are still required to get their vaccines and
That's
their
correct.
boosters.
Okay.
So none of that has gone away. I think what we're trying to get to, the information we're trying to get to the community is we need to pay attention to our community levels to help inform us of what we should do for ourselves and our family when we go out and about and go about our regular business.
Okay. So that is our COVID update. We are expecting a lot of dignitaries to come and join this event, and I think it will start around 6:30 or 6:40 around that time. But until then, let's talk to some of our vendors who are here. This is off work, and they come here, they participate with us, and they are hopefully very excited about this event. I could see some of them nervously and wanting us to not come to them because obviously there's so many tables and we have so very little time. But let's see who are the lucky winners that will join our conversation tonight. So let's go. Oh, she's ready. Look at that. Okay.
So this is Pacific Clinics.
Yes.
Yes.
Hello. We are Recovery Education Institute under Pacific Clinics. Thank you so much, Dr. Chow, for having us here. And we provide peer support services to individuals impacted by mental illness and or family members related to them. So we're here today to provide our support for anyone who's struggling in the community. Most of us are here because we have experienced the struggle ourselves. I myself have had family members who unfortunately have passed away due to suicide. So it's a very emotional, but it's also very nice to be here with support. So again, we're here just to provide peer support services and meeting all the social determinants of care, whatever that looks like. Thank you.
Thank you so much.
Thank you so much for being here today. I know this event is about raising awareness and giving hope to suicide. So it's sad, but we're trying to be a little bit more uplift to give people hope, right?
Yes.
Happiness. And I think I've heard that if you smile, it really increases the dopamine and endorphin in your brain. So that's one prevention.
Smiling and connecting.
There we
right?
go.
We-
Thank you so much for being
Thank
here.
you so
Thank
much.
you.
All right, I think this is the gentleman that's been waiting for
Yes.
us all night long. Weren't you here first tonight?
I was here.
Okay, well, why were you so excited to come?
To beat traffic. Yeah, so this is Olive Crest. We offer various mental health services, from parenting education courses, free parent at no cost parent courses in the community for parents and residents in Orange County in several different languages, and Zoom and in person. And we really collaborate because when our parents know what they're doing, our children are more healthy. And we also offer other services like Strong Families to help families at risk and in circumstances, mental health partnerships for schools. We have mental health clinics also in our corporate offices, and kinship services wraparound. So we do offer an extent of help for families, and we're just here happy to be here and support in this suicide prevention awareness event. Yeah.
So I'm sure your agency have a lot of employees. Why are you the lucky one here tonight?
That's a great question. I'm just blessed that way. But honestly, I am here. I am the outreach coordinator for my nonprofit, so I'm here to support and really to share and promote our services. Absolutely.
Thank you so much.
Thank you so
for being
much.
here. Thank you. Okay, we have a table with 3 people from DD Hirsch, right? So talk to us about DD Hirsch.
Yeah, so I can start us off. Here in Orange County, we're known as Survivor Support Services. All of our services are at no cost to the Orange County community, so we're very, very fortunate due to the funding that we receive to take that financial barrier out of any services that we provide. I'm going to start us off with our Survivors After Suicide Loss program. So we are able to provide individual, family, and support group grief counseling for anyone who has experienced a loss due to suicide. All of it, again, at no cost. We have various language capabilities as well available, and we're able to do this in a virtual setting as well as in our office that's located in Santa Ana. And I'll pass it over to my colleague Sarah, who's going to talk a little bit about our other services.
Hello. Yeah, another one of our services that we offer is our Survivors of Suicide Attempts support group. So that group is an 8-week support group that we offer for adults in English, and that is for people who have experienced 1 or more suicide attempts and survived. So we find that this is a really safe place that people can come to talk about their experience with suicide, and we know that it can be a very isolating experience for people who have thoughts of suicide, have survived past attempts. They know it's a safe place that they can come and talk about that.
Any plan for other languages besides English?
I'm not sure.
We
Do
hope to
know?
get it in other languages. Since it's a manualized program, we want to try to get it as equitable as possible in the additional languages that we provide, whether it's English, Vietnamese, or Korean, or other languages like Farsi and Arabic. So those are some of our subcontracted languages that we provide. So the hope is that we would get Survivors After Suicide Attempt group to be in other languages as well.
And where throughout Orange County that you hold these meetings?
So our services are all of Orange County. So if a provider asks us to come on site, we will try our best to come on site and meet them where they are. We've done services on school campuses as young as elementary schools. So really, we travel, we're virtual, we're in-house. So really just trying to meet the community where they are.
So what is the phone number or
Yeah, so we have
way of contacting
yes,
you
we have
guys for
several
those support
information.
group?
In addition to our support groups, we're starting a new program where it's after hospitalization or after a suicide attempt, someone can come to our program at no cost. They can be referred by themselves, by a physician, by a social worker, by a teacher, and get individualized or family therapy after their attempt. And it's an evidence-based practice that a lot of our therapists are trained in. It's cognitive therapy for suicide prevention. And again, no cost. And it's short-term, yet we really like to collaborate with other therapists. And our phone number here is 714-989-8311.
Okay.
And you can call directly for our intake line.
So 714-989-8311?
Yes.
Perfect. Thank you
Yes,
so much.
thank you.
Thanks for being here tonight.
Thank you.
All right. Okay, so Mecca. All right.
Hi there.
Oh my, 4 people. You just beat that table right there. They brought 4 people, guys. So, who's going to speak for Mecca?
talking.
All right.
Hi, so we're MECA. We're the Multi-Ethnic Collaborative of Community Agencies. We're actually a group of 9 different community-based organizations that provide services for the diverse communities of Orange County. We act as kind of a collaborative backbone for all of the efforts of our collaborative agencies. We offer a whole range of services that touch on substance use disorder, mental health, other types of support services. We have a program called Hope for Orange County that provides crisis counselors to the community that provide culturally competent and in-language services. We also have our early intervention services for older adults program, which targets at-risk older adults, people who are kind of on the verge of isolation. And we have actually 6 of our agencies that participate in that. And they provide services in all of Orange County's threshold languages. And they've been doing some special events actually this month for Suicide Prevention Month. And I'm going to pass it over to my colleague Shelley to talk a little bit about that.
Thank you. So the agencies that are working with us for this program consist of our 7 threshold languages: Korean, Vietnamese, Arabic, Farsi, Spanish. Am I missing any? Oh, Khmer. I apologize to the community. And then some of the events that they're doing for suicide prevention right now is some of the mental health workshops. And then some of those workshops consist of educating them on some of the importance of mental health, how they can get resources, how they can help those that are dealing with those situations. And then they also have little, I believe, little like arts and craft workshops on the sides, just to, coloring and whatnot along with that.
Yeah. So, which language do you speak for the agency?
I know how to speak a little bit of Spanish, and I am fluent in Chinese and
Fluent in Chinese, Mandarin?
Mandarin and
Okay,
Cantonese.
say something in Chinese and Cantonese to invite people to get resources, people in your community to get resources.
I am not confident in saying that.
Come on, let's go. 你講得嘛？講廣東話係咪？
我識講廣東話。
OK，咁如果人哋要有呢個服務，點樣 call 你咧？你個電話號碼係咩？
你可以打我哋電話喺714-202-4750。
啊哈，那國語呢？
可以打電話，在我們的電話是714-202-4756。
好，
哦，
好。
0。
OK, en español. ¿Qué es su teléfono?
I'm not that fluent.
Who? There we go. Tell us in Spanish what number to call.
Los invitamos a que participen, por favor. Los pueden localizar en el medio del internet y nuestro teléfono es el 714-202-4750. Muchas gracias.
Bien, gracias. Thank you, guys. Thank you so much. Okay, so now everybody's getting really nervous, right? If you speak another language, don't let me know, right? Okay, don't worry.
Si quiere habla español.
Okay.
Hi, thank you so much for inviting us here today. I'm actually representing 2 projects.
Okay.
And it's through the K-12 School Mental Health Initiative.
Okay.
And so one is a community networking project, and we work closely with all the 29 school districts in the county to provide networking opportunities in lots of different topics, webinars. We actually also will be hosting a youth-led conference this year as well.
Okay.
All of the services are free and they're virtual.
Okay.
The other project that I'm representing also is the resource directory.
Okay.
And what we do is that we have a landing page, OCSchoolmentalhealth.org, where you can actually access tons of resources in the school community. We also create products that are specifically tailored to the school community, such as crisis hotlines. We also have we also created this particular school-based suicide prevention campaigns and allowing schools kind of like a guide to support them in creating suicide prevention campaigns on campuses. And we also have this particular one, which is the positive self-talk coping cards. They come in the threshold languages, and schools or anybody in the community can actually in the school community can connect with us and request the services for free or the products for free, and we can ship them to them as well.
I like this slogan, help is hope. For you personally, why is that important?
Well, this is important because one of the pieces that it's a twofold piece. One is that we're also connecting these cards to students and families, and they actually can put them on their ID cards, because that's part of the kind of the law in the state of California, where school districts have to have those particular numbers on their school IDs.
Right.
So that can actually be ordered as a sticker or be provided for students to be put on their school IDs for numbers. And so part of it is the hope, really creating that hope for students that there's other resources available to support them in the time of need.
They got all the phone number here. So are all the school districts in Orange County implementing this?
Yes, what we do is that we have a steering committee where we connect with all of the 29 school districts, and they're the voice. So this is like a collective impact project where we're hearing what they need, what are the resources that are missing in the community. And so part of it is that we're launching this information so that schools can actually get it to the students and families.
Okay.
And we also partner with all of the different organizations here. We promote their events as well.
Yeah, it looks like it, because you all come and then you all say hi to each other.
Yes.
Usually people are a little bit more competitive in services, but these people just say hi.
It's like
a cool friend. Wonderful.
And I know we're sharing a lot of numbers,
Yeah.
and I can't remember any of the numbers, so I love how 988 is an easy number to remember.
That's the plug for 988.
The other number to remember is 211, and hopefully someone on that line can help connect you to all these resources. So you don't have to remember all these phone numbers, but
But the other piece is the OC Navigator, right? And OCNavigator.org. So thanks so much for being here.
Thank you.
Thank you. All right, so here's the brave soul from NAMI Orange County. I know your big boss is sitting in there. So, okay, I think he's watching and hearing what you have to say. So what is most important for parents when they have a loved one that suffers from suicidal thought? What can you do?
Sure. So I think for parents and loved ones and family members, first and foremost, it's great to listen. And to really know that, or let your loved one know that you're there for them, that you support them, and that they can come to you and they can trust you with whatever might be, affecting them at that moment. And really, it's that listening factor that helps people know that, they're not alone. And that's a big part of it. We do have our Reach In challenge, and a big part of that is really being able to reach into someone when they notice that something is going on, that someone might be struggling, and let them know that, hey, you can talk, you can say nothing, just know that I'm here for you, and anything you need, I can be there for you. It's one of those, how can I help and what do you need questions.
So how do I get a hold of NAMI? How do I refer any parents struggling with the children with mental illness to NAMI?
Sure. So you can either call our administrative line, that's 714-544-8488. We also have our website, namioc.org, and then our WARM line. So our WARM line is our 24/7 emotional support and resource connection line, and that is 714-991-6412. We have trained mentors there who are ready 24/7 to answer any questions or just be there for someone when they're struggling. And again, that's for individuals with a mental health condition. It's for their families, their friends, their loved ones. And, they can get that emotional support, but also we have connection to over 2,000 resources here in Orange County. And then they can also connect with any of our classes. We have emotional support and mental health education classes for family members, both of adults and family members of children, as well as classes for peers. So those are individuals who have a diagnosis. We have support groups. We have one-time educational presentations with Dr. Chow. You've actually been a guest for one of our presentations, so we are very grateful for that, and it's good to see you again. But again, anyone looking for emotional support, that's 714-991-6412.
So I imagine that if any parents that really they don't speak English and they speak one of the languages in Mecca, that you will work together to get them helped?
We can indeed, yes. And we do have Warm Lane mentors who also speak Spanish, Mandarin Chinese, Vietnamese, and Korean.
Great. Thank you so much. Thank you for being here. Good.
So one thing I've been noticing, there's a lot of hotlines, and they're available 24/7. And I kind of wish I knew these numbers when I needed it.
Yeah.
I, like you, had a lot of crises with friends and family, and you almost feel hopeless. And in the middle of the night, 12, 1, 2, 3, or 4 in the morning, it's nice to know that there's someone you can talk to. Thank you.
So I know we're running out of time, and these folks have a sign of relief. Oh, he's not coming to talk to you. But we do have Reconnect, a program for counsel and aging is here. And we also have our very own Orange County Health Agency Office of Suicide Prevention. And I was hoping that Supervisor Bartlett will be here. If you don't mind inviting Supervisor Bartlett to come out here, thank you. The reason why I want you all to talk to Supervisor Bartlett is because she's the one who directed the county to create the Office of Suicide Prevention. So thank you so much, Supervisor Bartlett. Would you share with us why you felt so important that you really order us to create the Office of Suicide Prevention?
Well, as co-chair of the Mental Health Ad Hoc, it was really important to create the Office of Suicide Prevention because suicide is preventable. But we've all got to take a part and we've got to be really proactive about it. And when you take a look, especially during the COVID pandemic, so many people were affected, from the youth to older adults. And we really need to take that important step to ensure that we keep our residents as safe as possible. And because suicide prevention, like I said, it is preventable. September is Suicide Prevention Awareness Month, so a very important month. Purple and teal are the colors that represent the month. And we need to really broadcast far and wide for people to talk about it. If they're not feeling well and they've got mental health issues, we really want them to feel comfortable reaching out and that it's okay. We have to take that stigma away about mental illness.
Thank you so much, Supervisor Bartlett. I know we're going to hear from you later on today, so look forward to that. Thank you so much for your work. So let me see. We have some staff from the Office of Suicide Prevention. Where is your director? I think she's in there.
Inside.
But so what kind of thing that you guys are doing under the Office of Suicide Prevention?
So a big part of our activities and really kind of our work is really built around what Supervisor Bartlett just spoke to, which was the idea that suicide is preventable. In order to get ahead of it and really take steps to prevent suicide, we need to ensure that the community has the information they need to take steps to support their loved ones and to support each other. It really is about coming together as a community and taking steps, all of us together, to support those who are vulnerable and experiencing thoughts of suicide.
Great. Anything you want to add? Why are you here tonight?
Well said. I'm proud to represent our department, and I take pride at what we do. It takes a lot of collaboration, and county has a lot of resources. There's just small representation of what's available, and it's really important to spread the word of what's available in the community so people can have hope.
Thank you so much. I think that's it, folks. I mean, you've seen most of our vendor here tonight, and we're getting ready for a large event with all the dignitaries here talking about suicide prevention. You've heard from Supervisor Bartlett. You will hear from the other 4 supervisors as well, and also our Chief of Mental Health and Recovery, Dr. Veronica Kelly. So after they give their speech, when the moon size and the sun go down and it become dark, you will experience, I think it's going to be very emotional, and that is light up the light for hope. And like I said, not only here, but all over Orange County, other tall building, important buildings, important places will also light up their light as well. So this is a well-coordinated effort from, believe it or not, a very small number of staff who could pull this off in a very short time. Dr. Bruvena Rao, who is the director for the Office of Suicide Prevention, I think this was her idea, and she wanted to do this. Our director of communication, Julie McDonald, put together a team, and Tehran also was helping, and they did this. They contact everyone else in the community, all the other entity that we mentioned earlier, and I don't think anybody said yes. Everybody said we want to do this, and in fact the light will light up for this whole week to ensure that we give hope to people who are currently experiencing suicidal thought, as well as family who have loved one who passed away from suicide. And so hopefully this will bring awareness, telling people that they're not alone. As Supervisor Bartlett said, this is preventable. All they have to do is seek help. And as you mentioned earlier, there's so many number. Who do I call, right? So the easiest way to get access to all the information and services would be ocnavigator.org. And that is a new platform that the county have put together with all the resources, especially mental health resources and addiction resources for you to reach out. So 2 weeks from now, on October 4th, we're going to come back to our regular studio, and the topic would be breast cancer. So if you have any question for us regarding breast cancer, please send email to yourhealthmatters@ochca.com, yourhealthmatter@ochca.com. Until then, be well and be safe, and just light up hope. Thank you.
Thank you.
Welcome, everyone, to the launch of our Light Up OC campaign. I'm Doug Chafee, 4th District Supervisor and Chairman of the Board of Supervisors. Thank you for coming here today, so together we can visibly inspire hope as we launch our Suicide Prevention Initiative. September is National Suicide Prevention Month. On behalf of the Board of Supervisors, the Orange County Healthcare Agency's Mental Health and Recovery Services terrific team, as well as our provider partners, I want to express how dedicated we are to preventing suicides in Orange County. Suicide is a global concern and a serious public health issue. It is the 12th leading cause of death in the United States, with almost 46,000 suicide-related deaths annually. And of course, suicides seriously impact Orange County. Our young people who are poised to transition to adulthood are especially vulnerable as they age out of support services. The past 10 years, data indicates that we have seen a significant increase in children and teens who have died by suicide. Our Light Up Hope campaign seeks to draw attention to how critical it is for us to reach out and talk to those who might be struggling with suicide thoughts. The Board of Supervisors and I renew our commitment to connecting with those who may be struggling and want them to know that they're not alone and not to lose hope. We could start by talking about this topic with our loved ones, and we need to let everyone know that by calling 988, help is available. Suicide is preventable. It's important to know the signs, find the words, and reach out. We hope you'll visit and share our website at lightuphopeoc.com. Now, I'd like to invite Vice Chairman Don Wagner up to say a few words.
Thank you, Mr. Chairman. I'm Don Wagner, Supervisor with the 3rd District, and I want to start by saying how proud I am of the work that we are doing in the county through this awareness initiative to share hope with anyone who is experiencing suicidal thoughts or knows someone who might be struggling. I'm also extremely proud of the work the community is doing to spread the message of hope and to help our friends, our neighbors, our families. As we shine our teal and purple lights on the beautiful new offices this evening, I hope this visual representation helps spark meaningful conversations and, most importantly, help save lives. When people are hesitant to talk openly about suicide, we miss a critical opportunity to offer help and to offer hope. With the launch of the 988 Lifeline, I'm encouraged that this service improves our ability to quickly connect people to the help they need. It's important that we amplify that message broadly. In a crisis, dial 988. There are counselors available to speak 24 hours a day, 7 days a week. Suicide is among the top 10 causes of death in the United States. Unfortunately, for more than a decade, the suicide rate has increased in the U.S. and especially among our veterans and our first responders. It's vital that we spread the message to the men and women who risk their lives daily for our safety that they need not suffer in silence. It's the job of this board, our healthcare agency, our prevention partners, you in the media, and each of us individually to do our part to remove the stigma around mental health issues and encourage people to get help. Remember, suicide is preventable. So let's light up hope right here in Orange County. It's my pleasure to invite to the podium next my colleague from the 2nd District, Supervisor Foley.
Thank you, Vice Chairman Wagner. I'm Katrina Foley, a County Supervisor for the 2nd District. And as we light up hope here in Orange County and raise awareness for this National Suicide Prevention Month, we want to just reiterate as Vice Chairman Wagner said, 988. You can call that number for help 24/7. Just today, I spoke to a combat veteran who was struggling, and I shared with him 988. He didn't know about that number. So help us spread the word, help us light up hope in Orange County and throughout America by helping people to know about 988. As the sister of a combat veteran, I'm personally invested in making sure that our veterans are not isolated and don't struggle with suicidal tendencies. Again, help is on the way. We have an estimated 117,000 veterans that live right here in Orange County. Unfortunately, this last year, we lost 22 to suicide. Suicide is preventable. So the county has launched some veterans programs that will help them to have peer-to-peer engagement, to identify those veterans in our community who are living in isolation and solitary, and engage them with other veterans to help them to avoid suicide. Also, through the pandemic, we learned that our LGBTQ plus community is 4 times more likely to commit suicide than their heterosexual peers. So whether you are gay, straight, or binary, we want you to know that you are accepted, supported, and loved. When we see the disproportionate rates in our LGBTQ plus community for suicide and in our veterans who are dying because of isolation, in comparison to the general population, we know we must do something to fix this. So I'm really proud to be here tonight with my colleagues as we light up hope in Orange County, and we begin what I hope is an ongoing campaign of suicide prevention, and so that we know as we light up hope and we encourage people to call 988 if you need help, please know that help is always there, and we're here for you. And now I'd like to invite Supervisor Doe from the 1st District to say a few words.
Thank you, Supervisor Foley. I'm proud to support this suicide prevention initiative and want to acknowledge the good work being done by the Office of Suicide Prevention. As COVID continued, we saw a significant rise in mental health cases as well as the number of suicides, especially among young children. Dr. Clayton Chow and I discussed the mental health impact of COVID, and Dr. Chow, as Director of Healthcare Agency, suggested creating the Office of Suicide Prevention, and I saw the wisdom in that immediately, and I'm honored to join with my colleagues in creating that office in 2020. Light Up Hope OC is an example of the great work done by the Office of Suicide Prevention in the short time since its inception. Our county now has expanded services, and the county has formed partnerships with many other organizations and nonprofits to help combat this preventable tragedy. Suicide is a tragedy that cuts across all demographics, but it is really only the most visible sign of the suffering endured silently by people. In 2020, according to the CDC, someone dies from suicide every 11 minutes, totaling almost 46,000 nationwide. That number will most likely climb when official numbers come out for the 2 years since COVID began. But more alarmingly, for every one suicide death, there are 4 hospitalizations for suicide attempts, 8 ER visits related to suicide, 27 self-reported suicide attempts, and 275 people who seriously considered suicide. These are sobering statistics. For many, is too difficult to talk about, let alone ask for help. When they feel depressed, isolated, having suicidal thoughts. And these feelings can make people feel alone and unwanted. And anyone can suffer from this, no matter what language you speak, how old you are, or how much money you have. To everyone, if you or anyone you know struggle with feelings of hopelessness, contact the National Lifeline by dialing or sending a text to 988 to connect with someone who can help. That number works 24 hours a day, 7 days a week, and is available in multiple languages. Remember, you are not alone. Your life matters. You matter. At this time, I would like to invite to the podium Supervisor Lisa Bartlett from the 5th District to share her comments.
Good evening, everyone, and thank you, Supervisor Doe, for the introduction. I'm Lisa Bartlett, Supervisor for the fabulous 5th District. As Vice Chair of the Mental Health Ad Hoc, I am very supportive of the campaign and encourage that the lighted buildings around the county will prompt people to talk about and instill hope in those who are at risk for suicide. Losing even one life to suicide is devastating and unacceptable, especially when we know it can be prevented. When we created the Office of Suicide Prevention in 2020, we were confident that the healthcare agency's mental health and recovery service team would do great things to support those at risk for suicide in our community. Mental health is one of my top priorities, and I'm proud of the work being done on this issue, bringing it to the forefront and to create these highly visible opportunities to showcase hope. Suicide impacts the senior community particularly hard. Older adults comprise just 12% of the population, but make up 18% of all suicides. Loneliness is one of the top reasons why older adults attempt suicide. Many of us have lost a spouse and may not have family or friends nearby. Social connections are critical to good mental health. It's so important to keep in touch with your older loved ones, even if it's via Zoom. Ask how they are feeling, and if you get the signs that they are depressed, anxious, or they start to give away their possessions or put their affairs in order, express your concern, reassure them, and most importantly, get help. Having the opportunity to light up our new office buildings is such a great opportunity for us to showcase just how dedicated this board is. And we're definitely pursuing the destigmatizing and engaging in that important conversation about mental health concerns. I so appreciate the commitment of the board that we've made continuing the prevention work in Orange County. Each one of us can play a role in preventing suicide by learning the warning signs and reaching out to someone we might be concerned about. Together, we can truly make a difference. I'd like to invite up the chief of our healthcare agency's Mental Health and Recovery Division, whose commitment to caring for the mental health and well-being of our residents helped get us here today. I'd like to invite up Dr. Veronica Kelly.
Thank you so much, Supervisor. September is National Suicide Prevention Awareness Month, a time to raise awareness that suicide is preventable and to offer resources to help us all take action. If you are concerned about a friend or a loved one that they might be contemplating suicide, these are 5 action steps you can do now to intervene. First, ask the question. Be direct. Ask, are you thinking about killing yourself? And then listen. What we know is talking about suicide helps people, especially people who are contemplating suicide, by reducing the anxiety that they're feeling, thus reducing the risk of suicide. Number 2, be there. If someone just told you they're contemplating suicide, hang out with them. Call for backup folk if you need. You can help them dial 988, the 3-digit National Suicide Prevention Hotline, to speak with someone immediately, or they can call 1-855-OC-LINKS to be linked with an Orange County provider of services, or you can go to ocnavigator.org for additional resources. What we know is that when people feel connected and when people are not isolated, that is a protection against suicide. Third thing, keep them safe. If someone's just told you they want to take their own life, ask them if they've done something prior to sharing that with you. Have they taken medication, any pills, any substances? Also ask them if they've done this before, if they've contemplated it, if they have a plan. That lets you know how imminent the risk is. And finally, ask them about their access to firearms. Having a gun in the house substantially increases the risk of suicide, 8 times for men and 32 times for women. Number 4, help them connect. Suicidal thoughts don't just go away. So when the crisis is over, make sure that they can access their clergy, a counselor, a physician, to help them get ongoing services. And finally, follow up. Research shows that sending a simple email to check in on somebody substantially reduces the risk of suicide. This year, the county is shining a light on hope. And this event does just that. It reminds us all that there is hope, things get better, people recover, and together we can inspire hope. But enough of me just telling you about it. Let's take a look at what it actually looks like in action.
Good evening, everyone. I am Bhuvana Rao with the Office of Suicide Prevention, the healthcare agency. I'm so excited to be here to launch this Light Up Hope OC campaign with each of you tonight. The healthcare agency is hosting this week-long campaign to raise awareness, as you heard, on suicide prevention. And I thank our Board of Supervisors and our HCA leadership for supporting this campaign and the work of our office. You saw this brief video of so many different iconic buildings all throughout the county in all 5 supervisorial districts, and many, many different cities, lit up in teal and colored lights. We hope that people will stop and wonder about these lights. We hope these lights serve as a reminder that we can all play a part in suicide prevention. You heard all of the speakers before me talk about how important it is that we need to talk about this issue openly, but individuals may not know what they need to do to help. Also, when people hear suicide prevention, they tend to think that means they're being asked to prevent an actual suicide death or attempt. But that's not what we mean by suicide prevention. Suicide prevention, as you heard, is about giving hope, to light up hope, to give hope to a loved one who may be struggling to cope with life and may be experiencing hopelessness. It is a reminder that people who are struggling, they don't want to die. They want to end their pain. So it is about communicating with our loved ones who may be struggling in silence, that they're not alone, and more important, that help is available. HCA has many great prevention programs to boost the mental health of participants, including our emotional, psychological health, and social well-being, and also programs that help to break down stigma. And today you see many of our programs partners with tables outside with really great resources. These programs are designed to provide a variety of coping tools to help bounce back when we may be struggling, maybe with negative moods or some challenges. But sometimes it can be harder to bounce back, and sometimes these coping strategies don't quite work out. It's particularly during these times when you see someone struggling, reach in without judgment. This also allows people to open up about their struggles, and they are able to feel comfortable to talk about their feelings and struggles. Because when you reach in, it lets them know that there are people who care about them. We hope that the Light Up Hope in OC campaign will empower each one of us here present tonight and beyond to become more aware and develop skills to have these difficult conversations. Because these conversations, as you heard, truly could help save a life. If this campaign can raise this awareness alone and connect those who may be struggling to services, we will consider this campaign to be an initial success. It is now my honor to introduce you our invited speakers who are part of the continuum of suicide prevention service partners and advisors in the community. I will briefly introduce Dr. Michelle Rose, who is the co-chair of the Community Suicide Prevention Initiative that you heard was established in 2019 with the support of our Board of Supervisors and Dr. Chow before he was part of the agency. Dr. Rose is also the director of the community programs at Hoag Hospital, and this coalition is made up of many community representatives, including Dr. Rose, and more important, many community members. This provides us strategic guidance to plan future programs in the community. Next, we have I'm going out of order. We have Steve Pittman, who is the president of NAMI OC and who needs no introduction here. NAMI OC provides many important mental health support services to residents, including the 24/7 emotional support warm line to individuals who might be experiencing mental health concerns or loneliness. And last but not the least, we have Shari Sinwelski from D.D. Hirsch, who provides the National 988 Suicide Prevention Crisis Lifeline Services, and we're so fortunate that D.D. Hirsch also happens to be in Southern California. And with that, I would invite Dr. Rose.
Thank you, Dr. Rao. As Dr. Rao mentioned, my name is Michelle Rose. I currently have the privilege of being the co-chair of Be Well Orange County's Community Suicide Prevention Initiative. In addition, I'm here today as a mother of 2 young adults, the wife of a first responder, and a surviving family member, as my father-in-law, a veteran and owner of a firearm, died by suicide in August 2020. The Community Suicide Prevention Initiative has been and continues to be a grassroots, community-led movement. Our intention has been to bring the community together and create awareness about the importance of suicide prevention. Everyone has a role to play in suicide prevention. We want to educate, inform, support, and help bring hope, connection, and purpose to all members of the community, especially those struggling with thoughts of suicide. I want to thank the Board of Supervisors for formalizing our efforts and validating our work with their financial support of the Community Suicide Prevention Initiative in 2019 and the creation of Office of Suicide Prevention in 2020. Now, more than ever, we need to continue engaging the community, our key stakeholders, and all of our policymakers in creating space for this very important life-saving work. For my family and for yours, we must push together for the continued investment of resources and dollars in sustaining suicide prevention efforts. The lives of our loved ones and the lives of our most vulnerable community members are depending on it. Suicide is preventable. Please help us spread hope. If you'd like to learn more about the Community Suicide Prevention Initiative or how you can help prevent suicide, please visit the Be Well website at www.beweloc.org. Thank you for your time. I'd like to invite up Mr. Steve Pittman.
First, let me say that it's wonderful to be in a room full of people as committed as this one is to finding solutions to this problem. So thanks to all of you. NAMI Orange County would like to thank the Board of Supervisors and HCA for putting a spotlight on the issue of suicide prevention. Before the pandemic, there were not enough clinicians to provide the services, and it's worse now after COVID than it was before. I recently read a statistic that said for every 10 clinicians that get licensed in the United States, 13 leave the field. So it means that the shortage is even going to grow larger and larger over time. The only way to fill this void is to embrace families, the faith-based community, and the larger community as a necessary part of the solution. I heard a young man speak recently about his suicidal ideations and a number of attempts of suicide, most recently jumping off the Golden Gate Bridge. He's very intelligent, very articulate, and following his talk, he had a Q&A. And one of the audience members said, "Clearly, you're a very capable man. Couldn't you just reach out for help?" And he paused, and then he said, "I needed somebody to reach in." The Zoom world over the last 2.5 years has made reaching in difficult. COVID seems to be ebbing now, and it's easier to reach in. Please make a point of it. Instead of the perfunctory greeting, "How are you doing?" and the equally perfunctory response, "Just fine," stop. No, really, how are you? I want to know how you are. Be someone who reaches in. And our next speaker is Shari Sinwelski from D.D. Hirsch. Thank you.
Thank you. It's an honor to be here this evening. This October, D.D. Hirsch Mental Health Services will celebrate 80 years of impact, and our Suicide Prevention Center, the first in the country, founded in 1958, celebrates 65 years. The mission at D.D. Hirsch is to save and transform the lives of children, adults, and families through world-class, whole-person mental health care and suicide prevention. We envision a future where everyone can thrive with access to high-quality care that treats mental health and physical health as inseparable. Our partnership with the Orange County Healthcare Agency allows us to support members of the community in their darkest moments. Through HCA funding, D.D. Hirsch provides a variety of no-cost suicide prevention services, including individual, family, and group counseling for people who are struggling with thoughts of suicide, have made an attempt or were hospitalized for suicide, or who have lost someone to suicide. And of course, as we've heard, beginning in July, D.D. Hirsch started answering calls for 988, the 3-digit number for the National Suicide Prevention Lifeline that we've been answering for over 17 years since its inception. For more information about the services that I mentioned, visit crisiscare.org. I've worked in suicide prevention for over 25 years, providing counseling and training to over thousands of individuals who have lost someone to suicide or faced their own suicidal crisis. And I've heard so many people say that finding hope came through knowing that they were not alone, and knowing that it was okay to not be okay, and in finding a place to talk about how they were feeling without judgment or stigma. Tonight, buildings across the county are lit in teal and purple in recognition of Suicide Prevention Awareness Month. Events like this weren't happening 25 years ago when I started working in this field, and they mark a crucial change in the way that we look at mental health. Before joining D.D. Hirsch Mental Health Services, I was privileged to be working at the national level, implementing 988 and with the Suicide Prevention Lifeline. And the entire country, you may or may not know this, looks at California as an example for how suicide prevention should be done. And so I'm proud to be back here in California working alongside our partners here at events like what's happening in Orange County. We've heard a lot of statistics this evening about how suicide, how many people are affected by the negative effects of suicide. And I wanted to say one statistic that was a little bit more hopeful to end the evening. For every one person that dies by suicide, 316 individuals seriously consider suicide and go on to find a way to live. And I'm confident that we hear every day individuals that call 988 and they tell us how they heard about the number. And I'm confident that individuals are going to see these lights across the community and it's going to save a life. So together, alongside our partners here at the Healthcare Administration, we're on a crucial mission towards mental wellness. And I know that positive change will continue to come. Thank you.
So this concludes our comments right now. We'd like to invite you all to gather outside with us while we light up hope in our communities. Thank you.
All right. Chairman, you're right here. The ones on this side, on this side, and then you sit next to him, and we'll have everybody lined up. After this is over, we'll get a little video clip of everybody flipping the switch, and you'll get a little sizzle reel of all of these lighted buildings. I saw it, so that's why. President, you want to come on this side? Even? say the numbers out loud when it starts, and we'll all do it with you.
Can you pick up the sound? Don't you just switch off, guys? Do we need to test the sound? Millie?
Yeah, let's move the mic.
Am I going to be able to move this okay? Am I going to learn anything that way?
Okay, parents. Try to skip down a little bit.
How am I doing there? Huh?
Keep that a little more space.
Good?
Yes.
How's your shot for that, Ellie? Good? Mike okay? Okay. Julie?
Should we do the countdown now? Okay.
10, 9.
Flip the switch. Oh, flip the switch. Very confusing.
Push it down. Just push it down.
It says off here and you want to go on, you flip it down.
Push it down.
Right now.
Push it down.
Don't we flip down first?
Just trust us. Just push it down.
It doesn't make sense. Just do it. That's what she's saying.
Okay.
There now.
Turn it out.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
We got a cool one.
Oh, there we go. There we go.
Very nice.
We're hopeful that the many lights around Orange County, and right here in our offices, will start conversations, empower people to help, and ultimately save lives. Now take any questions from the press. Oh boy, a very inquisitive press. I guess we have to celebrate. All right, thank you for that.
And if everyone could please join us at our vendor tables right behind you so you can get valuable resources. And remember, continue the conversation so that we can continue to light up hope in Orange County. Thank you.